This gentleman was tending his succulents on New Year's Day and took a cactus spine to the cornea, presenting 3 days later with a full-thickness laceration, briskly cytal positive, as can be seen here. The anterior segment OCT clearly demonstrates the communicating tract from the posterior to the anterior side, broad on the posterior side where there's some missing tissue, but very narrow on the anterior side. I didn't think that glue was likely to close this long term, and so we opted to take him to the operating room for closure. Our goal here is a 50 to 60% depth suture pass, visualizing the area of the opening and letting the suture pass directly through it. It's important to close this in a fashion that's not going to create a fish mouth, is not going to create too much astigmatism as it is paracentral, but is going to create a watertight closure. After passing the suture carefully and taking care not to tear any of the tissue, letting the needle pass directly at its own curvature, we then tensioned with a 3-1-1 locking suture, and after the initial 3 and tightening it, check for cytal positivity. There's an opportunity to adjust the suture. I prefer this over a sliding slip knot because I think it's much easier to titrate for less if you went over, as well as to tighten it down if you went under. In this case, after what I thought was the appropriate tension, and locking it, we check for cytal positivity and find that the tract itself is now totally sealed, but there is now a small tract leak from the suture itself coming at the distal pass of the suture. I'm pointing to it with the forceps. This is common, and if it can't go away, if you can't get it to fix itself in the OR, you can just leave it. This will probably resolve over the next day or two. However, a neat trick here is that once you trim your knot, if you bury the knot into the side that has a suture tract leak, typically that larger bulk of the suture is enough to actually seal it watertight behind itself. So we finish with the second and third pieces of the knot. Trim. Bury the knot. And check for cytal positivity. Sealed nice and tight. This patient will do well. We'll remove this suture no sooner than a month from now, although may leave it for 3 months if he is not too astigmatically affected. I placed a bandage contact lens just for overnight, and we'll remove that at the post-op day 1. I put him on topical antibiotics. Did not include steroids in the initial regimen because I want to create a little bit of fibrosis early on. We'll monitor how he does.